I think it's obvious that there's an uptick. There's an uptick in the entire country. This is not good if you look at the numbers and where we're going, whether it's in the state of Maryland or whether it's elsewhere in the country. We're not headed in a good direction. We are at levels of virus that if this had been May or June and we were making decisions about to open, we would not open. We got below these thresholds before we made decisions to open things up again. And so we're not looking at it at what was only a few short months ago considered to be a not good place to be.
We are seeing the data trend in a way that we don't like. And we had hoped that these would be a couple of anomalous days, but unfortunately we are seeing trends that suggest that our numbers are increasing, not only on a local level, but also regionally as well as at the state. And so in terms of, as you know, last week we repackaged our data dashboard to hopefully make it more easily readable and digestible for folks at home. And in those measures that we've put out, when you're following that, you can see that our cases per 100,000 have increased a fair amount over the last month. And in particular, today we have our highest cases per 100,000 numbers since mid-June. And that number is troubling because we have seen, again, continued days where we're having multiple days reporting cases over 100.
We have increased our testing. In the context of increased testing, you would expect our test positivity number to go down. If anything, it's gone up slightly. And so in spite of the increased testing, we're finding not just more cases, but also seeing an increase in positivity, which is not the trend direction you would either expect from increased testing, but it's also further evidence of the fact that we are seeing an increase or a surge in cases. I believe the state is seeing an increase in hospitalizations. The governor referenced that in a tweet a few minutes ago, about an hour ago, I guess. And so that's something that they're monitoring. We're paying a lot of attention to that as well. We had a meeting with the governor's staff last Thursday to talk about surge in our hospital system and how the system should be ready for a surge of flu and COVID over the coming months. And where our bed counts are and what things we need to do to make sure that we have as much capacity as possible. We've got ventilators that the county has purchased, and we're going to work with the hospitals to get those tested and trained on. And so obviously, contextually, there's a lot of work going on behind the scenes. That's a reflection of the fact that we're seeing increased cases, and there is increased national concern and local concern about what that means.